You are watching RML PYQ 2021 and this is part number 3. If you have missed the previous two, then you are doing a mistake. Make sure you watch that. Now, before we start part number 3, one thing which is very interesting, I was just taking a recent class for the assistant professor examination, but there I found something very, I was astonished, if I am pronouncing that right. I was literally astonished that okay, they are setting paper from here, and that was completely not imaginable or not at all. I have think or you understood, na? It was not at all in any case that this question is going to come from this book. Okay, so wait for the reveal. We will talk about that book as well, and that particular chapter number 4 is very important. Okay, so if you are preparing or if you are a Mphil beginner and if you are watching this video for it maybe 2026, then this book you have to add to the a la carte. Now let's start part number 3. Catastrophic thinking is common to several anxiety disorders. The term describes, first of all, from where this particular question is coming. This particular wait. Okay, now we are good to go. I just opened the wrong paper. Why? Because this is what we did in the previous part. So if you have missed it by any means, then this is not at all good for you. Okay, okay, you revealed the answer already. Now, catastrophic thinking is common to several anxiety disorders. The term describes what it describes. First of all, which is very important, from where this question is coming. This question is coming from the F book called as the Fish Clinical Psychology. You will get the link in the description. You can order it right away from there. Okay. Catastrophic thinking is common to several anxiety disorders. The term describes what? Categorizing all experiences as either extremely positive or extremely negative. This is another thing or another type of distortion. So this will come under the head of your cognitive distortions. Okay. Now, focusing on negative events and ignoring positive ones. This is one type of, all these are what? All these are your cognitive distortions. And where they are mentioned in the CD thing. Okay, the cognitive dissonance, the cognitive distortions area, F book, you will find it over there. Okay, and what is the correct answer over here? The correct answer is your option number 3, worrying that the worst will always happen. Okay, this is the correct answer. Option number 3 is the correct answer over here, that worst will always happen. Taking things very personally, no, not about that. Okay, now we will move on to the next question, that is going to talk about amenorrhea is present in anorexia nervosa. This term means, okay, now first of all, this has to do with what? This has to do with the XX people. Why? Because it is basically of two types. First is your primary amenorrhea and second is your secondary. Primary is when you never get period or something like that. It is about delay in your first time of period, and this is about your more than 3 months gap. Okay, so let's suppose an individual XX is not having a period, maybe 3 months, on a time period of 3 months. After that, it is difficult to have that period, or basically in the terms menstrual cycle we are referring to with this period thing. Okay, so menstrual cycle is the thing over there. So if you never get by the age of your puberty or the very first time, then it is called as the primary amenorrhea, and the second one is your secondary amenorrhea. Okay, so amenorrhea has to do with what? It has to do with your menstrual cycle and is present in anorexia nervosa. And now what does it mean? An intense fear of weight gain. Do anorexia nervosa people will fear for the weight gain or weight loss? Think about that. What do you think is the correct answer? Yes or no? Now, excessive exercise. This is one more thing which is going to happen. And absence of menstrual cycle. I hope you got the correct answer over here. This is the correct answer. Okay, absence of menstrual cycle. This is also of two types. The primary one, where you are facing the difficulty to get this cycle for the very first time in your life by the age of your puberty. And the secondary one is a gap of 3 months in your menstrual cycle. You are not having that proper thing. Okay, now absence of menstrual cycle. And what is the fourth option? Body image distortion. It has nothing to do with that. Okay, nothing. An intense fear of weight gain? No, not at all. Okay, now why this has to do with your absence of menstrual cycle is because for these XX people, what is going to happen is, first of all, the GN, gonadotrophic hormone, GnTH, is going to release when it releases by the time of your puberty and all those things. And when it is not released properly, why it is not released properly? Because the hypothalamus is not sending that particular signal to release the gonadotrophic hormone. Okay. And now if this hypothalamus will not send the proper signal over here, and then the pituitary gland will not work properly. I hope you know about this axis and HPA1, and this will not release the proper hormone, and then there will be absence of menstrual cycle in the XX people. Okay. Basically females we are talking about by this XX. Okay. And then these are some common causes of amenorrhea. Common causes of primary. This is was had a period by 15-year-old. Okay. You might have seen these kind of cases. Why problem can be because of some chromosomal or genetic problems. It can be issues with your pituitary gland. This is what we are talking about particularly. Why? Because this will not release proper hormones. Why? Because your hypothalamus is not sending the proper signals to this anterior pituitary gland. Why? Because your hypothalamus is busy with what? Your anorexia nervosa, which we are doing this particular question. Okay. And for your secondary amenorrhea, these can be all causes. This is not at all that important, but yes, you just need to know the difference between the primary one and the secondary one. Okay. This is about amenorrhea, and what is the correct answer over here? I hope you got it. It is your absence of menstrual cycle. Okay. Now you are busy with your eating thing, and which is making your hypothalamus also busy. And now this hypothalamus is not able to send proper signals to the pituitary gland, and then all the problem with this amenorrhea getting started. Okay. And literally this is a good paper. For the very first time I am seeing these kind of questions, which are some good level questions. Amenorrhea is present in anorexia nervosa. Okay. So you just have to think beyond, but again, basic things get into picture, because if you don't know, most possibly an intense fear of weight gain you might be marking in the examination hall. Okay. So for next time, there are two types of amenorrhea, primary and secondary, which is important. Now moving forward to the next question, the chance of developing schizophrenia if you have an identical twin with the disorder is approximately. Now to solve this question, from first of all, what is the correct answer? Correct answer is your what? Correct answer is your what percent? 1%, 50% is the correct answer. Okay. Now why I just show you the correct answer? Because you also know that reading book is how much important for you. If you are going to sit and listening to these kind of videos is way important. Okay. Now this question is directly 100% from your N book, and you'll be shocked to see what you are going to see right now. You won't imagine that they are just doing this thing. Okay. Now before this you don't know. Now you are watching these kind of videos. You know, okay, they are going to ask from here, and you are going to witness in 2025 session as well. The chance of developing schizophrenia if you have an identical twin with the disorder is approximately 1%, 10%, 80%, 50%. I hope you know the distinction or difference between the identical twin getting born from only one single egg, and the dizygotic, we have the two eggs over there. Okay. Now get ready to witness this thing and make sure you are liking the particular video. Okay. Now in this N book, a short textbook of psychiatry, you can just read about this thing. Biological theories. What is genetic hypothesis saying to you? The concordance rate for monozygotic twins is 46%, and for dizygotic twins is 14%. Once you read this statement, 46%, what is the most logical answer you can think of? Okay. And if you don't know, identical twin and monozygotic twin are the same, then you need to literally brush up your basics. Refer to the C book to cover up the basics, then move on to the A book, then N, and then F. Okay. This we call as the CANF framework. And to practice these questions, you have the CANF 7000. You can take that. Okay. Now 1% will you mark? No ways, no ways, no ways. Only and only 50%. See, you might mark 80% depending upon intelligence, or yes, depending upon intelligence. Okay. Because most of the cases you have read about identical twins, fraternal twins with correlation of your nature nurture controversy and that thing. Okay. That is why they have given smartly 80%, but the correct answer is your 50%, and you just saw the solid proof over here, 46%, and for dizygotic twins is 14%. Okay. I hope you got this, and whatever in part number first, second and third we have done, majority of the clinical psychology questions are coming from here only. Now moving forward to the next question, panic disorder is where, this is once again a simple one, there are recurrent and unexpected panic attacks. This is a basic question which you should definitely know. An individual experiences a singular panic attack, no excessive anxiety, no, okay. There is a fear of panicking in enclosed spaces. Now this is your work to comment down below what is this called. You know this thing, okay? Fear of enclosed spaces. In the C book you will find, in the N book also you will find, okay? Once again coming from the N book directly, this particular question. Now we will move towards the last question, I guess. Yes, this is the last one. Which of the following are not included in the ICD criteria for schizophrenia? Do you know the answer? Delusions, hallucinations, disorganized speech, or is it about catastrophic thinking? Now, definitely, catastrophic thinking. I just told you this will come under where? This will come under the cognitive distortions. Okay. Then why in this world you will go and mark this as an answer? I mean, obviously here you will mark this as the answer, but delusions, no, it is included in the ICD criteria. Disorganized speech is also included over here, and hallucinations are also used, I mean not used, but are included over here. Okay, so there is no chance in this world that you will not mark a catastrophic thinking once you have completed this particular kind of video, where you are getting everything right in front of your eyes. Okay, so B is the correct answer. And to show you that this is what I think, yes, you will find it over here. Okay, now cognitive distortions are, what are these? These are errors in thinking that impinge upon the person's view of themselves, of other people, and of their own future. Okay, these are from the notes from the CMP membership. And when you will come all or nothing thinking, all these are questions are coming from here only about this particular thing. Okay, now when you will see this thing where it went, yes, this magnification. Okay, sometimes magnification, minimization, catastrophizing, and this is the 100% question that came up. You focus on the worst possible outcome and overestimate the probability that it will happen, or you are inappropriately shrink the importance of an attribute or event. Okay, this is called as the catastrophic thinking. And also you can check that particular question over here. This particular question we just did. Catastrophic thinking is common in what is that? Worrying that the worst will always happen. Okay, you are not doing any of the distortions over here. Only and only what? Only and only this option number C is the correct answer. Okay, you just found it from here, and there are many more, and this is your proof for your questions coming. And now this question, amenorrhea or amenorrhea is present in anorexia nervosa. You will not read it anywhere, but where? This question is also coming from where, you know, this is also from the N book. Okay, if you have not read, it's completely you thinking that okay, question is not going to come. There are different kinds of examination, different approaches, and this is one of that particular beautiful examination which is asking inches and edges, if you say. Okay, so are you ready to get astonished? This is your chapter number 12 from this particular book, behavioral syndromes associated with psychological disturbances and physiological factors. Okay, when you will come below or down or under this PDF, you will find the disorders can broadly be classified into the following categories: eating disorders, sleep disorder, sexual disorder and dysfunctions, postpartum psychiatric disorders, and psychosomatic disorders. And can you just see this thing? There is often a body image disturbance. Can you just imagine this thing? What is happening? Can you just read this thing? Body image distortion. Are you ready for this? Now, when you will come over here, eating disorders, you will find anorexia, bulimia, obesity, binge eating disorders, psychogenic vomiting. Okay, still it's fine. Anorexia nervosa is an eating disorder characterized by the following prominent clinical features: It occurs much more often in females as compared to the males. The common age of onset is 13 to 19 years of age. Okay. And now again, if you have read this book properly, you will be able to understood this thing that yes, second option is there is an intense fear of becoming obese. This fear does not decrease even if body becomes very thin and underweight. Okay. This is also option given over here, an intense fear of weight gain. Agreed, you can mark this thing, but wait. Now read the second statement. There is often a body image disturbance. The person is unable to perceive own body size accurately and this and that and that. Okay. Now, okay. Still okay. You can also mark option number D. Completely agreed with you. But now there is refusal. Okay. This thing. And see option number 8. I mean the point number 8. Amenorrhea, whatever, primary or secondary. You just know the first time menstrual cycle, the after the gap of 3 months, okay, is often present in females. So can you understand or can you get to know this thing, or are you able to understand this thing that okay, this point number 8 and 1 2 what was written over there are different? Even if you know this much that okay, point number first, point number second, point number third and point number 8, everything is different, that is why they have written differently, you will easily able to understand that okay, amenorrhea they are talking about is present in over here. A and D are not going to be the option. What left is your excessive exercise or absence of menstrual cycle. So because of this excessive exercise, sometimes, okay, not every time, sometimes if it is get more excessive, it leads to the amenorrhea. Okay, this is also a a cause for your absence of menstrual cycle sometimes. And this is how the book will give you answer if you read it properly. And with this, we are finished with our part number 2, that is of your RML PYQ 2021. I hope you liked the video, enjoyed the video, and now it's time to once again witness that thing that okay, they are asking question from here as well. So do you need to read that book? We will find out shortly. Why? Because this particular question, where that went, where that this not, yes, okay. This question, within attention deficit hyperactivity disorder. Make sure you watch this properly, okay? Because it is very, very serious. Within attention deficit hyperactivity disorder, which of the following is not classified as a problem relating to hyperactivity impulsivity? Okay. This question, experiences difficulties in playing quietly rather than sitting still, rather, squirms in seat and fidgets, talks excessively and doesn't appear to listen when being told and this and that. Okay. Now, are you ready? Okay. We are into the minute 18 and let's start to explore that particular book. We will now discuss several disorders like attention deficit hyperactivity disorder, ADHD, autism, this, SLD. Okay. The two main features of ADHD are inattention and hyperactivity impulsivity. What is it written over here? Are inattention and hyperactivity impulsivity. Hyperactivity impulsivity. Attention deficit hyperactivity disorder, ADHD, you would have read this n number of times, but now hyperactivity impulsivity might be the first time. Now, what are these? These are the two main features of ADHD are inattention and hyperactivity impulsivity. Children, just like you, who are inattentive, find it difficult to sustain mental effort during work or play. Inattentive, find it difficult to sustain mental effort during work or play. Which of the following option is most related to this thing? Inattention. Doesn't appear to listen when being told something or spoken to. Isn't it? Children who are inattentive find it difficult to sustain mental effort during work or play. We are telling them, okay, listen this, but they don't. Still, they have hard time keeping their minds on any one thing or in following instructions. Common complaints are that the child does not listen, cannot concentrate, does not follow instructions. Okay. Is disorganized, easily distracted, forgetful, does not finishing assignments, and is quick to lose interest in boring activities. So for next time, it becomes important that in attentive, you have to note down all these things. Okay. Now, children who are impulsive, we are going to talk about them. Seem unable to control their immediate reactions or to think before they act. They find it difficult to wait or take turns, have difficulty resisting immediate temptations or delaying gratification. Minor mishaps such as knocking things over are common, whereas more serious accident and injuries can also occur. This is about impulsive. Hyperactivity also takes many forms. Children with ADHD are in constant motion. Experiences difficulties in playing quietly. Okay, but more on that. Sitting still through a lesson is impossible for them. The child may fidget, squirm, climb and run around the room aimlessly. Just change the word and give these guys to answer for the Mphil entrance of RML 2021. Rather than sitting still, squirms in seat and fidgets. Where it is? The child may fidget, squirm, climb and run around the room aimlessly. Parents and teacher describe them as driven by a motor, always on the go and talk incessantly. Now, is incessantly a synonym of excessively? Comment down below. I don't know about this thing. Talks excessively. Okay. So these all things are coming from where? This came in 2021 from your NCERT. Okay. Now, if you are an Mphil beginner, if you are watching this video as a PYQ for revision or whatnot, if you are a beginner, apart from your CNF 7000, your CNF books, do NCERT of 11th and 12th. 12th is majorly important because of your Mphil thing. Okay. And this is, we are discussing chapter number 4. So it is also very, very IMP for you. Okay. It is very, very important. Now from where this is coming from your NCERT and you will find everything over here. Okay. This is your chapter number 4, which we are discussing, and it includes most of the things from the very basic level to the very advanced level. It is covering everything. Okay. As you can see, it is having your anxiety disorders, OCD, everything is covered over here. Okay. All right. And while taking the previous lecture of that AP examination, just telling those guys, okay, you have to read from there. And this was completely, I just quickly reminded, okay, I have seen this thing where I have seen this squirm fidget in the RML 2021 paper. And this is especially for you. If you have watched the previous part, you know we have discussed this question particularly in the previous part as well. And this is coming directly from your NCERT chapter number 4, psychological disorders. With this, we'll end this video. Wish you all the very best for the upcoming examination. May it happen on 2nd or not, we don't know yet, but wish you all the very best. And make sure you watch all the 3 parts, do proper basic things, do the CNF books, do the CNF 7000 plus mock series if you have access to. If you don't have, take quick access and do those questions and read these books only. With this, we'll end this video. Wish you all the very best. If the examination is happening on 2nd, if not, it's okay. If it is happening, it's still okay. And see you all soon with another banger, another new video. Till then, goodbye, take care, and wish you all the very best. Don't forget to subscribe. Okay, wow.